A young Springfield man has successfully traded his tough life on the streets for a promising career in the medical field.
But this 25-year-old hasn't forgotten where he came from or the help that he got along the way.
Just a few weeks ago, Kalof walked in himself to begin his job as a patient care technician.
I love working here. You actually wake up in the morning and I come to work and I actually enjoy my job.
I basically became pregnant when I was really young, had my baby at 15, and was left alone to raise her.
I struggled through just about the worst of everything. I've been through domestic violence.
One of my biggest struggle would be seeing my father passed away, being HIV positive, and him telling me at the end to make sure I take care of my brother and sisters.
I just wanted people to know that there's nothing bad enough out there that you can't go through and you can't overcome.
This program turned my whole life around, and there's no turning back now.
Baystate Health's charitable mission is to improve the health of the people in the communities every day with quality and compassion. And through our workforce planning efforts, we've identified what we call critical jobs, and those are jobs that are the hardest to fill because there's a shortage of people with those skills and those qualifications, and these are the jobs that we have the greatest need.
So we reached out early on, several years ago, to our community partners to begin to engage in some discussions about developing talent for the healthcare industry in the region. And that's how, through that planning process, we received actually a WCTF Workforce Competitiveness Trust Fund grant. We used the dollars to support the development of this patient care technician training program.
Before I found out about the grant, I was actually homeless, living in a shelter with my kids. When I get the phone call right after I spoke to her that I did get accepted into the grant, and I started crying just because it's something big for me. It was something really big for me.
Initially, when I heard about the grant, I was without a job. I was recently laid off. I was kind of confused and lost. I went and I filled out the test, I did the procedure, and they called me. And I didn't think that they would call me, and I did it.
Under the Workforce Competitiveness Trust Fund grant, the employers develop acute care curriculum that gets piggybacked on top of the CNA training. So this new ARRA Employment Partnership Grant will allow us to continue the work that we developed. It will also allow us to pilot the acute care curriculum at the community college in the area.
And diversity is really a very important part of our workforce strategies, which is to have a workforce that's reflective of the communities that we serve as an organization.
They financially helped us, provided us with everything we needed, down to a stethoscope and our first scrub to use for when we went for interviews. So we were in need of nothing.
Our grant coordinator, Christina, she was very helpful. She pulled for us, she helped us with our resumes. She made sure that we were ready to work.
Amy Rist, the project coordinator, she was definitely excellent. Always a phone call away if we need anything. I know personally for myself, I was having issues with money, and she actually was able to give me a $100 gas card, which helped out a lot.
Now I'm living in a real comfortable home. When I get out of work, I come home to actually it's a home. It's a home. I get to relax. I get to sit on the couch. I got to buy a car. My family's all good. There's never a day where my mom's missing food in the fridge. So yeah, I'm doing real good.
We now have a branded partnership in the region. It's called the Healthcare Workforce Partnership of Western Mass. It's being led by the Regional Employment Board of Hampden County. And we now have invited many other healthcare employers, education organizations to the table to engage in discussions about how we can provide training and educational opportunities that meet the needs of the region's healthcare employers.
So this grant supports our mission, it supports our commitment to diversity, and it supports our commitment to our community by providing people with the opportunities for the education and the development of the skills that we need to fill our jobs. So this is a win-win for all of us.
Because it's basically got me where I want to be in life right now. I'm happy working with patients and loving every minute of it and having an impact in their lives that I know I wouldn't have in any other job.
My sisters and my younger brother, they're all very proud of me. My friends, they're just like overwhelmed, like, wow, Shalonda. They think I'm like an RN. I'm like, not yet, but I'm getting there.
Personally, it has changed me. You know, I've become a different person. Like, I didn't believe in myself, and everybody else believed in me. They pushed me through everything. It made me the person I am right now. If I had to describe this program in one phrase, it's like my light. It took me out of the dark and brought me into the light, and now I'm shining.